I now welcome Professor Philippe Grandjean and Charlotte Kroløkke, who will be joining us today via international video conference from Denmark. Professor Grandjean and Ms. Kroløkke, as noted in your invitation, parliamentary privilege applies only to people giving evidence in Australia. Parliamentary privilege is a special right that means that you cannot be prosecuted or disadvantaged because of anything you have provided in evidence that has been accepted by the committee or because you gave this evidence. However, because this privilege only applies within Australia, a person outside of Australia will not be protected by parliamentary privilege. As such, you may wish to refrain from making adverse comments about any specific person or entity, because you'll get in trouble. For the Hansard record, will you please state your full names and the capacity in which you appear today?
I will go first then.
Yes.
My name is Charlotte Kroløkke. I'm here as a professor in cultural studies from the University of Southern Denmark. Thank you.
Thank you, Professor. Professor Grandjean?
Well, I'm out of French origin, so I'm Grandjean. Philippe Grandjean. I'm a professor I've been a professor for 40 years in Denmark, and I'm also a research professor in the United States. So even though I have reached retirement age, I still keep going, and it's like PFAS is something that requires continued attention. So I'm happy to be here today.
Thank you. Fantastic.
I have some remarks just to start with. Is it time for that now? Or?
I was just going to invite you to make a short opening statement.
Okay.
And at the conclusion of both of your opening statements, we'll then ask questions. So over to you. Mr. Grandjean.
Okay. I guess that's me. All right. Thank you for the invitation. I was supposed to be in Warsaw in Poland today. Poland is the current chair of the EU because there's a conference on PFAS, and I was supposed to speak, but I sent them a video presentation because I thought it was important to be at least virtually with you because I had already written a report to you, and I thought that I should be available for possible questions. My major conclusion is that we're dealing with long-term consequences of the so-called forever chemicals. And usually we focus on a single issue, namely that the PFAS are almost indestructible and will accumulate in the environment and cause exposures for decades to come. But there's a second issue. The PFAS pass the placenta and penetrate into the fetal circulation. They reach the brain and all of the other organs, and they're also excreted in human milk, which means that the heightened exposures happen at the most vulnerable time of human life. And there's a phenomenon called developmental programming. And developmental programming means that, the fetus is born with its organs, but the organs have to learn how to function. And this is where PFAS interferes with the healthy development. And that we're now starting to understand that that is linked to adverse effects later in life. I'm aware of the Australian PFAS guidelines for PFAS in drinking water. I note that the limit for PFOA, is 200 nanograms per liter, or 200 ppt, which is 50 times higher than the EU limit. I also know I've worked with the United States Environmental Protection Agency, and they have proposed new lower limits, and for PFOA, it's about 1,000 times less than the Australian limit. Now, things have happened in the United States lately, as you know, so we're not sure where that ends. But based on the most recent science, this is what the experts in America have decided. I also wanted to mention that in May of this year, the Stockholm Convention decided to add the long-chain PFASs to their Annex A. And I think that you better become familiar with what the Stockholm Convention, which is international, of course, has decided, because that means the potential for a ban by January 1, 2026. That's very soon. And it's based on science. So the more research we're producing, the PFASs appear to be more toxic than previously thought. And exposure limits have been lowered. However, I understand that PFASs are useful. They are financially important. They're fairly cheap to produce, but highly expensive to remove after they have been disseminated. I have participated as a medical expert in several court cases in Australia, so I'm quite familiar with exposures in various Australian communities. And it's clear to me that you have in front of you a serious public health problem, and I'm therefore very eager to help you finding the best, the most ethical and prudent decision for now and for the future. So again, thank you.
Thank you very much. Professor Kroløkke. Professor Kroløkke, can you hear me? Yep.
Yes, good afternoon, and thank you for the opportunity to contribute to today's hearing on PFAS. As already mentioned, I'm a professor of cultural studies, and in my work I examine PFAS not only as a chemical pollutant that poses significant risks to human health, but also as a force that profoundly disrupts the cultural and social dimensions of everyday life. My work follows two main trajectories. First, I have analyzed how PFAS pollution in the Danish Commonwealth, comprising Denmark, Greenland, and the Faroe Islands, has been represented and debated in scientific, parliamentary, and popular scientific discourse. In 2023, this region received the dubious distinction of being home to the most PFAS-contaminated populations in the world. In Denmark, contamination is often traced to firefighting foam, which has leached into the soil and water near organic farms, for instance. In contrast, in Greenland and the Faroe Islands, PFAS exposure is linked to atmospheric and oceanic currents, as well as to the presence of military Air Force bases. Second, I acknowledge how PFAS contamination affects lived experience. The health consequences are well documented, I think. Elevated cholesterol, increased cancer risk, reproductive harm, and disruptions, as already mentioned, to maternal practices, such as, for example, the recommendation in Denmark that mothers with high PFAS levels avoid breastfeeding. But beyond these biological effects, PFAS pollution also threatens cultural life. It alters how communities live, work, and relate to their environments. It erodes traditions, practices, and relationships that are essential to cultural identity and to both individual and collective well-being. So in closing, my main argument is that PFAS contamination is not only a matter of toxic exposure and public health, it is in fact a cultural crisis. It reshapes how people inhabit their environments, how they care for one another, how they relate to their land and country, and how they sustain traditions and systems of living across generations. Addressing PFAS pollution, therefore, requires more than technical solutions. It demands dialogue with affected communities and a broader recognition of the social and cultural harm that it inflicts. Thank you.
Thank you very much. Senator Pratt will ask some questions.
Thank you very much. I wanted to ask, starting with question on Indigenous communities, but it also interrelates with your evidence, Professor Grandjean, about the evidence around the effects on infants and babies and crossing the placenta. And, for example, in Australia, there is an association between one of our Closing the Gap targets to lift the health of Indigenous Australians is to improve birth weights because they're below the Australian average for First Nations children. What kind of focus should that put on us in terms of managing PFAS and monitoring people's exposure to it? How might we, is it the same for everyone, or do we need a special focus on the vulnerabilities of First Nations communities in that context?
Well, if I can start answering, number one, you are quite correct. We are very concerned about the next generation and future generations. There was actually a paper just published where researchers had found adverse effects, PFAS associated, in the second generation, that is grandchildren, probably mediated by a DNA methylation, epigenetics, as it's called, that happened in the mother, the grandmother. And so the focus on the future, the focus on the children is absolutely correct. There was a report that was published, now I can't remember if it was 2022 or 2023, by the National Academy of Sciences in America. And the National Academy essentially concluded that PFAS exposure is enforced upon residents and citizens. Yeah. And therefore, they have a right, because they were never asked by government, do you agree to receive this exposure to PFAS? They were not given any advice how to avoid it. They were not told that they could have a blood test done. They were not given medical support. And so the National Academy recommended to examine people who were exposed to elevated amounts of PFAS and offer them advice how to lower that, and then also carry out ongoing, let's say, cholesterol measurements, etc. And the National Academy in the U.S. is independent of government, and it's composed of frontline scientists. And I was a reviewer of that report, so I know it quite well. And I think that in Australia, knowing that there are these different sites, especially near airports, military bases, etc., that are heavily contaminated, including also the Aborigine community in Toowoomba, near Oakley. So I think, essentially there are two issues here. One issue is, let's get out of this dependence on PFAS for all of these purposes, because it leaks, it disseminates. Let's stop that. And number two is, with all of these tons of PFAS in the environment, how do we deal with that? Because it's overly expensive to remove it. How can we deal with that? And so there are these two problems that need political attention, in my mind. Thank you.
Thank you. Might I add just a little bit to that? I had a little bit of a sound issue, but what I heard from your question, the very end of it, was a question in terms of First Nation people and Indigenous communities accordingly. And I do think we have to be especially attentive to the damage that PFAS and pollution in general has done to Indigenous communities and First Nation people. And I'm saying that in part because of the relationship that Indigenous communities have to the land and country upon which they live. So a contamination of land and country has severe effects on the communities that live upon this land and country where their ancestors have also lived and where they have a cultural history of performing traditions and being connected to land. So I think we do have not only we have to be attentive to these issues, we also have a moral obligation to view, regardless of today's political sphere, the ways in which many of these pollutions are also implicated in past colonial practices and thus accordingly have a potential to do harm to First Nation people in a way that we need to be very attentive to.
Thank you. Can I ask, Australia's about to, as of 1st of July, ban the import of non-stick pans and other cooking utensils that have PFAS in them. I think the Chair and I were kind of wondering if that's a worthwhile ban, then clearly what is the messaging about to people who continue to use those pots, and what does it mean, you know, how should we respond if we find retailers putting these pots and pans on sale before it comes in? It seemed to me that, you know, we're just going to pat ourselves on the back for the ban and let it take place without actually using it as a communication opportunity to look at the science and to talk to people about how they make their own inquiries about these issues.
If I may start, pans and kitchen utensils that are covered with Teflon are a minor source of exposure to the individual at the time that you already have them in your kitchen. Right. It's a production of these utensils, because to generate Teflon, you generally, at least in the past, you have used PFOA, and that's the one I mentioned before, PFOA, and there has been documented enormous releases and disseminations of PFOA because of the production of Teflon. Right. Teflon, and nowadays they use Gen X instead of PFOA, and Gen X toxicology is still at a very early stage where it seems to have a shorter half-life and to break down, but we're not quite sure. And Teflon as such means that the PFASs are polymerized, and I'm looking for, I have here on my desk somewhere a molecule. I will look for my PFOA molecule. They polymerize, and so it's bound on the pan, and therefore very little is released, at least after you've used it for a while. Yeah. Please wash it as soon as you get home with your new product, though.
Can I quickly ask in that context, because it's my understanding that the ban that starts July 1 includes PFAS, PFOA, and PFH times X. Which was the worst one of those? Was it and is it likely still to be, why are we banning it now if it's not prevalent? What is the extent, or have we been historically behind in still utilising products with this higher level of toxicity in them? Oh, we've lost sound.
Start again.
Okay. I don't know about Teflon production in Australia, so I figured that most of what you have originates from previous uses of PFOA, and it seeps through the soil and will reach the groundwater, and it will also move to contaminate other drinking water wells, private wells, etc. So this is a continuing problem, and I think that the kitchen utensils is simply a minor issue. We should stop making them. We should phase them out. But let's not make this a major focus. It's the environmental occurrence of these compounds.
That's good, because it does help contextualise for me the perhaps somewhat bureaucratic answer that the bureaucrats gave to us. And yes, we're going to ban them, which means that they'll no longer be we're no longer contributing to their production, but we're not, catastrophising or drawing overdue attention to what is a minor part of the problem. So that's helpful, thank you. One of the recommendations, which sounds in line with what your evidence is from the Australian Academy of Health and Medical Science, which is to establish human biomonitoring to track PFAS, to monitor to start more immediately monitoring pregnant women's level of PFAS and other chemical contaminants, and expand studies examining the links between PFAS exposure, health outcomes, with priority being given to research on the impact of early life exposure. Are they the right recommendations? How can we improve them, and how would we go about implementing them?
We'll have to hand over, Senator.
Yeah.
It can easily be improved, of course. The problem is that one analysis of PFAS in serum would easily cost 150 or 200 Australian dollars. Perhaps more if it's a private laboratory.
Yeah.
This is an expensive analysis. So you have to figure out how much you want to monitor people rather than monitoring the environment where the PFAS comes from. The medical aspect of this is that human milk is essentially an advanced result of evolution. It's the ideal nutrition for the baby. And what are we doing? We're contaminating it with some of the most toxic compounds that humanity has ever generated. And I feel very, very bad about trying to make a choice. Should I tell a new mother not to breastfeed her baby, or should I say, well, listen to WHO, they recommend 6 months of breastfeeding, and your child will just get something like 10 times higher PFAS concentrations in the blood than you have, that the mother has, 10 times. That's what we see as a result of long breastfeeding periods. And as I said before, this is the most vulnerable age in human life, and we are confronted with a serious ethical problem because we have simply been sleeping. We have not done anything for decades in regard to PFAS control.
So in terms of, one more last question. If you're telling us we should focus on the environment and getting rid of it because the science is already established, where do we direct people to for what we should be doing? And in that circumstance, surely there is a point in monitoring if you've already got elevated levels of PFAS and you're relative to other people and you're already pregnant. It could inform your choice to breastfeed or not, for example.
Charlotte?
Yeah. I mean, I think you have the medical expertise. However, I do want to add that I think it's a double approach. I think, of course, we have to have focus on the environment. Yet there are communities that are being strongly affected by this. In Denmark, we had a small community of 187 people, of which 118 had elevated levels.
Wow.
And in those kinds of circumstances, it very much makes sense to give the acknowledgement of this kind of contamination that kind of priority in which individuals are being informed and being tested for their PFAS levels. I think in order for them to make choices as far as their, for instance, parenting is concerned. And this was they were given that opportunity by the Danish state due to testing. So I think there is something to be said for a double approach. And in this regard, it speaks to how expensive it is to clean up after pollution. And it also speaks to making these sorts of efforts of trying to eliminate these sorts of substances.
Thank you.
There are two potential ways to deal with an elevated serum PFAS concentration. One possibility, it has been discovered, is that the subject starts taking cholesterol-lowering medicine. But hey, you're not going to sign prescriptions to healthy people, young people, to eat cholesterol-lowering medicine just to get PFAS out of their bodies, because there may be adverse effects of that. And to treat something highly toxic with some medicine that's not needed is strange. The other potential avenue is to go for blood donation, because it has been found, and we're studying this right now, if you donate blood, one pint every month or whatever, then you actually lower your PFAS concentration in your body. However, that means that the PFAS-containing blood donation is transferred into patients who really need human blood. They don't need the PFAS. So we have some issues here to think about.
Yes, thank you, professors. We're running out of time. I just want to say to that we did have the Red Cross today as a witness, who said that it's they're low levels of PFAS in the blood, so it's not really that much to worry about, and that's some work we have to do in this country. And be great if our questions don't cover everything that needs to be said. Please provide any more evidence that you have that we can use to challenge some of the other witnesses and other evidence that we're seeing as part of our report and our findings and recommendations. I've just got a few questions because of the time. I understand that the EU is working to restrict all PFAS as a class. Can you explain the rationale behind treating PFAS as a class and the scientific justification for that approach?
If you look at the way science has developed, then we started looking at PFAS and PFOA because they were the PFAS most commonly encountered in the environment and in blood samples. And so with time, we started looking at PFNA, the one that has 9 carbons, and PFHXS, the one that has 6. And now we're starting looking at additional ones. And so little by little, we're learning more about additional compounds. And if you go for a response to the current level of science, you would of course go for a regulation of PFAS and PFOA, but you should not forget that there are compounds that look like them and that have yet attracted less science, and we know less about them. In Europe, we refer to something called the precautionary principle, and that takes into regard exactly this situation, that we should also be aware that there are additional risks. And I know the PFAS industry has switched to other related compounds that have the same physical and chemical properties, and therefore are very advantageous to the industry. But they forget that then they may be as toxic as those that they're supposed to substitute. And we should not forget that. We need to act in regard to compounds that are similar to PFOA and PFAS, that is the group of PFASs, and that's what the Stockholm Convention people did. They said it's a long chain, that is C8 and longer chains. That's what they included in their statement from last month.
So the EU is moving to ban PFAS under an essential use framework. Could you explain how that works and how the essentiality of a PFAS chemical is determined in those systems and whether it's viable for this country?
I'm not sure that I don't have the expertise to respond to that question, so I'll pass it on.
I thought I could pass it on. No, I think in regard to essentiality, the people I have met think that all uses of PFAS are essential. But still, when Denmark and other countries banned the use of PFAS for food wrapping materials, that was handled very easily, no problem. Of course, we don't need PFAS in, let's say, flour bags or whatever it is. And so in the assessment of essentiality, my recommendation would be a compound cannot be considered essential if its production and use result in environmental dissemination. It can't be essential. So we need to look at those that can be kept in closed circuits inside the walls of the company. And there may be some uses like in microelectronics. I'm not an expert either. But I think we need to take this very seriously because of the reasons I said in the very beginning about these forever chemicals. Thank you.
So in your opinion, and speaking to both professors here, should all toxicological data submitted for chemical approvals, including PFAS, be publicly available, for instance, like a publicly accessible registry?
I certainly don't see why it wouldn't be. I think what's important here is also to grant the consumers agency in making choices that are informed, and that is given only when this kind of data is being made available to consumers. So I think there is a lot of transparency that's important here to grant from the industry to the ultimate consumer that's also experiencing the negative effects of this.
When looking at the history, the problem has been that much of the information was kept secret. And this was not because of problems with the academic researchers. This was the private sector. And for example, in 1979, it was shown in a monkey experiment that PFAS could act on the immune system. 1979.
Wow.
My paper on immunotoxicity in children was published in 2012. I mean, it's a whole generation where the industry kept this secret. We need to get this information out. And also think of Brussels, which is where the European Parliament and the Commission are housed. Brussels is also the home of more than 70 employees of the PFAS industry. I don't know what these people are doing in Brussels. I don't know what they're telling the commissioners or the members of parliament. This is, of course, not public information, but there is a missing balance here, because Charlotte and I will write papers and we will publish in scientific journals or whatever is appropriate, and that's publicly available, but not what the private sector is doing.
So what lessons do you think other countries like this one should learn from the PFAS contamination and litigation experience in the US and the EU? We know, particularly in Wreck Bay, the Aboriginal community there, that won a small case because of the cultural loss because of PFAS, but it is also a cancer cluster. And because this country doesn't identify PFAS as with health effects that cause cancer, what can we do?
I mean, I think there are a number of things that can be done. First of all is, of course, to recognize the severe health effects that PFAS has on the not just the body that is here now, but also the bodies that are to come, such as the offspring, reproductive effects, etc. And it extends beyond, I think, the health effects of PFAS to recognize the cultural impacts, mentioning the Wreck Bay case, of course, but other cases like it. So when we're talking about policy recommendations, I think one of the things we have to learn is that a PFAS pollution goes beyond health, it goes beyond generational health effects. It also extends to cultural impacts, and we need to ask ourselves questions related to what cultural impacts that PFAS pollution imposes as well. And that can certainly be learned from cases in the EU and in the US, and there are plenty of cases in Australia as well. In a sense, taking PFAS pollution out of the concern of merely being health-related or the loss of property value, as is sometimes also mentioned, to deep cultural health effects.
Some countries have discovered that removal of PFAS, let's say from drinking water, can cost billions and billions of dollars, American or Australian dollars. This is very expensive. And sometimes the companies that cause the pollution have since then gone bankrupt. And that means that the public has to bear the cost. So some sort of solution to that issue is of course needed. I know that from Professor Bischoff, who's a law professor in the Netherlands, that country actually has a legislation that will allow the court to take the company leaders, the directors, the managers, to court and put them in a trial for their criminal behavior, according to Dutch law. And I wonder if this is something for you to consider, whether that will be an appropriate and useful approach in Australia. Thank you.
Thank you. So in your view, in both of your views, what are the most urgent reforms needed internationally to ensure that chemical regulation prioritises human health and environmental safety over commercial interests? Just a small question.
Well, basically, I'm a physician, and I try to understand what chemicals are doing to human health, and I try to produce the most reliable and solid information, and I usually stay away from making statements on the political aspects or consequences of whatever we discover, because I think that the most important thing is that we have freedom to conduct this science of the highest possible quality. And America has the USA has taken away a major grant from me to study PFAS. We had a center grant. And so, and I think we need to protect the researchers.
Yes.
And make, like we talked about before, make this information available to people, so that in a country like Australia, you can jointly decide what's the most appropriate way to move forward, because we have to do something. And certainly looking at the recommendations from the Stockholm Convention, there was a problem with the World Health Organization because they accidentally hired some industry consultants to help them develop criteria for water contamination, and that report is almost useless. But otherwise, the World Health Organization is worth listening to, the National Academy of Sciences in America, so that there are sources that have produced overviews with general recommendations that might be of use to you.
Okay, I'll add a few things. I think we need to make chemical contamination very expensive to produce. I think we need to stop producing them. And one of the ways that we could do it also is to inform consumers, to make consumers aware of which products are being heavily contaminated with these forms of PFAS, for instance. And perhaps we need to rethink the ways in which we live lives that are easy, convenient, non-stick pans, etc., and reconsider ways of living that perhaps have less of those kinds of conveniences, but more health. And at very minimum, give consumers the option to choose based on informed decisions. But I also think we need to have companies be accountable for producing PFAS that have for years been known to be toxic to the environment, to the people, to the animals at large that are in that environment. That needs to be held accountable.
Well, thank you. That ends this session. Appreciate you both coming today and being witnesses to this very important inquiry for what we can do in this country going forward. As I said earlier, if you do have anything to provide further that you haven't been able to talk about in the short time that we have, please provide that. And also, if you've been asked to provide additional information from Senator Pratt or myself, please do so by providing that to the Secretariat as soon as possible, or no later than 5 p.m. on Monday, 30 June 2025, our time. So thank you again, and thank you for all the incredible work that you're doing to help educate and eradicate everything around PFAS. So thank you.
Thank you.
Thank you very much. That was incredible.
Thank you. Well, that concludes our inquiry today. Thank you all for appearing, and thank you to Hansard and Broadcasting for their assistance, and to all those that watched online. Thank you. I stand adjourned. Committee stands adjourned. Thank you.